Good evening. I'm Gary Christenson, Mayor of Malden, and we're here tonight to provide you with another update on our battle against COVID-19. And before I do, I know that many of you are celebrating Passover, and I think tonight is Holy Thursday, and so we just wanted to let you know that although we can't be with you physically, we are with you spiritually. So we want to wish everyone, despite what's happening, a happy Passover and a happy Easter. So tonight we're going to conduct this show as we have in the past, which is I'll provide some introductory remarks and updates as to what's happening on our end. And then tonight our guests are State Senator Jason Lewis, and we also have, of course, our Health Director, Chris Webb. So from our end, as of today, Thursday, April 9th at 2:30 p.m., we now have 245 tested and confirmed COVID-19 cases. On top of that, we are monitoring 313 additional potential cases. And I know our health director will talk about that shortly. A couple of other updates. Our health department, Mr. Webb, issued an order over the weekend to our grocery stores, which now limits the number of customers in a store at any time, as well as people that are in line outside. We also yesterday declared signed an executive order that affects the tax payments within our community. So we're going to push out the dates upon which personal property tax bills were due, real estate, and we also extended the deadline for abatement applications. Monday night, we held our regularly scheduled school committee meeting on Zoom, and it was there that we voted to accept the Malden Public Schools remote learning plan. And that started actually Monday afternoon, Monday morning. So if you want more information about any of those updates, please visit us at cityofmalden.org/coronavirus updates. A couple of state and federal updates, which I'm sure our state senator will allude to more, but the one that we're asking everyone to comply with is the CDC recommendation to wear a face mask when outside of your home. And then the other thing is our public buildings remain closed, but if you do need to contact us, please call 781-397-7000, or you can visit cityofmalden.org. And before I turn it over to our senator and health director, we want to make sure that everyone knows that they have a part to play beyond taking care of yourself and your loved ones, and that is if you want to help. And we've had so many calls from people wanting to help, and that's really been one of the best outcomes of what's happening here, is that you can visit Malden Neighbors Helping Neighbors, which their website is maldenneighbors.org, or you can call 339-224-4842. So that's if you want to volunteer or you need help. And then the other thing we have down is the American Red Cross is in need of donations, and they're looking for help, so you can visit them at www.redcross.org. Before I go to our guests here this evening, we do want to elaborate a little bit on the outpouring of support that we've seen across our city. That remains very strong. Just this week, Encore Boston Harbor was in touch with our community. They're going to donate flowers, daffodils for our seniors, our senior housing. We also had Cornucopia step up, and they're willing to deliver meals. Stockpot Malden on Pearl Street has been in touch with Mystic Valley Elder Services to let them know that they're a resource if they need help during this crisis. And of course, Pizza still continues to lead the way on trying to do so much, just not for Malden, but for cities and towns around us, especially those that are on the front lines. So that's one thing that we've been very happy to see, not surprised, but really happy to see that the spirit, despite what's going on, remains very strong here in our city. So without further ado, what we'll do now is we'll have our State Senator Jason Lewis say a few words, followed by Chris Webb, our Health Director. And then, of course, as we always say, most important, we want to get to your questions. So without further ado, our State Senator Jason Lewis.
Well, good evening, everyone, and thank you, Mayor Christenson, for inviting me on the show, and thank you so much to you and your whole team for your really strong leadership through this very difficult time that we're all going through. So thank you for everything you're all doing.
Now, you know you're supposed to look over my shoulder.
Yeah, thank
Right?
you. Absolutely, Marie Louise, right there. But you have a terrific team,
Yeah,
and you know this
sure.
is when it really counts. You know, having strong, competent people in government is important all the time, but it's particularly important when we're going through a
and that was
crisis, right?
very evident Tuesday morning at 10 o'clock. We did our department head meeting through Zoom, and it was just so great. As I introduced each manager, I was able to tell a story that had occurred through them and their department during this crisis, a positive story, and it was great.
Well, that is so well deserved. And I just want to also thank all the folks who are on the front lines right now, obviously in our hospitals and health centers, our first responders, our public health officials like Mr. Webb, our grocery store workers and drivers, everybody who is doing just really, really important work right now. And I want to echo as well what the mayor said in terms of thanking all of our local community organizations who are stepping up. I had a chance to go over to Bread of Life earlier today and help deliver some groceries. And, they haven't lost a beat. I mean, it doesn't matter that we're in the middle of a pandemic and a public health crisis. They're there, putting the groceries together, and volunteers are delivering them to our seniors and others in need. So we really, really appreciate that. Just quickly in terms of what we're up to, in terms of I think our local, state, and our federal government are really trying to work together in sort of two strategies. The first is to do everything we can, of course, to contain the spread of the virus, because we have to flatten the curve, as we know, and try to prevent our hospitals and our intensive care units from being overrun with patients. And I think we're doing a good job of that, because people are following advice around physical distancing and public health guidelines. The other strategy that we're pursuing in our government is really to try to address the enormous economic and social hardship, that is coming as a result of this epidemic. And so and we can talk more about this evening, but there have been a lot of actions that have been taken both at the state level and the federal level. For example, to really expand unemployment insurance benefits, to make those benefits available to more people, including those who are self-employed and independent contractors, to expand the amount of money that folks can receive if they're have lost their job or been furloughed or have had their hours reduced, and also to expand the number of weeks that they can receive benefits. There's also significant programs that are now available to help our small businesses and our nonprofits as a result of the new federal legislation known as the CARES Act. And I want to encourage all of our small businesses, nonprofits who are really struggling in this tough time to look at these programs, the Paycheck Protection Program, the emergency EIDL loans, economic emergency injury disaster loans. Anyone who needs more information on these programs and resources that are out there, please, my office is a resource. Our state representatives are a great resource as well. But we want to make sure that anyone who's in need, whether they need access to unemployment benefits or food assistance or health care through the Mass Health Program, or assistance for your business like the Paycheck Protection Program, we want to make sure you're getting the help that you need.
Great, thank you. All right, Mr. Webb?
Good evening, everyone. Everybody wants me to do the statistics, so I'll start with that. I'll finish off with the mayor. We had 6 new confirmed cases today. That's a low number for us, but I think that is deceiving, simply because the caseload's coming in so quickly that we're not getting them pushed out to us as quickly as we were in the early stages.
Okay.
It's quick, but it's nowhere near as quick as it was in the first stages. So I would not take 6 new cases as a plateau point by any stretch. We have 245 cases reported to date. 62 contacts are, we've also worked with 62 contacts who were living with someone that was positive, and as a close contact. So we're monitoring those people as well. So that came out to 313 cases. we have another 114 that have recovered or finished their isolation and quarantine time. That was a big number that a lot of people were looking for last time I was on, and it was a very difficult number to get together, but we did it. So it gives us a grand total case of 427 cases so far.
Okay.
I do want to push on people, if I can, keep following the directives. There's no time to slack, none. This is not it. It's not going to be 2 weeks from now. It's not going to be 3 weeks from now. It's probably not going to be 4 weeks from now. There'll be slight changes, as we're seeing already. Some of the workspace changes are coming. But I think wholesale socializing, recreation, things like that, we're looking at a good solid month.
Okay.
And I think people should start getting it. The things I'm seeing when I have time to watch, the original ideas that people are using for entertainment and exercise, keep them coming. You know,
Okay.
to share them as often as you can. I think a lot of people, you know, me for one, not that creative. So it's helpful.
Okay.
While I have a minute, I'd like to thank all the nurses that are working for the city. They're doing incredible work. Maria Tamagner is the public health nurse. Patty Tramandozzi is the director of nursing for the school department, and her staff, including Kathy Donahue, Maureen Vona, Julie Gavin, Gina Clancy, Vicki McDonald, Nessie Salamurovic, Debbie Spadafora, Marie Filippico, Kristen Diggin, and Sheila Butler have been instrumental in making our jobs that much easier. We had a lot more organization going. We've been able to do a little more outreach, spend a little more time with each person that we're in contact with. Before, you can imagine, 427 people takes a lot of time.
Right.
So we appreciate all of their help, and they've all volunteered for coming in, and you know, we didn't have to ask, they were called us.
Okay.
We were glad to have them. And we'll keep them as long as we can.
Okay, great. Thank you very much.
Thank
So
you.
one thing that we've been able to do during these weekly updates is we borrowed a segment from the hit show Around the Rim, hosted by Nesta Dudley. So we're now going to go in the web, where I get to ask you one question and you can't pass on it. You have to give your best answer as to what you think what you think it is, where you think we're going. So I'll start with the state senator, and this actually came from Ron Hogan and Chuck Ranigan on our finance team.
So
Do
this
you
one's gonna be
have an
tough.
idea of what all this will mean to the budgets of cities and towns like Malden next year?
Yeah, that is I guess not the 64,000, it's the $64 million question, right? So things are pretty uncertain right now, as we know. This pandemic is having a big toll on the economy. Unfortunately, we're seeing a big spike in people going on unemployment insurance, losing their jobs or having to cut back. A lot of businesses are seeing their business significant downturn. So unfortunately, that all does affect the tax revenues, right? Both at the city level, things like meals tax, other excise receipts, and at the state level, it has a big impact because we rely on meals taxes. Also, sales taxes are way down. Nobody's driving, so gas tax receipts and income as well. So that unfortunately is going to have a big hit. But on the other hand, what's positive, or at least offsetting, we have a very significant rainy day fund for the state. We've been building that up over the last decade, so that's a good thing. And we'll obviously have to draw that down, our reserves. And then the other thing is the federal stimulus act, the CARES Act, does include funding for a lot of different programs. And so that's also going to help us as well. We don't know the exact amounts yet. We're sorting through that, but that's going to help. So hopefully in the next month or so, we'll have an idea of what the fiscal outlook is for the state, and we'll have some sense of the state budget for next year, and then we'll be able to give guidance to the city. Okay, very good. And Mr. Webb, I know just recently some news reports are saying, the numbers looks like it's getting a little, we're starting to see a little bit of daylight, but as you mentioned, don't be fooled. So how long do you think this thing is going to go on?
I think you're going to see some semblance of the lifestyle we're living now, really until mid-August. Then, before that, there will be things that change. What, I don't really know what order will go in. It's going to come down to, obviously, the economy first. Right. But people should be, comfortable with the idea that restaurants, for example, when they first open, it's going to be reduced seating, and it's going to be, everybody's going to be spread out. So that social distancing is going to last for quite some time, because people will then start be moving between, there'll be more movement of people, and they'll be back on airplanes and doing all those things. And we have to keep those social distancing things in place so that when people return from trips from overseas or wherever they go, that they don't reinfect.
Okay.
So it is going to be, it's a long haul. I think people are watching the news. I watched it tonight. It was difficult to not feel like we're at the peak of this.
Right.
But it's not. New York is at the peak of it. We're next.
Got it. Okay. All right. Thank you both. Now let's do the most important thing. Let's take some questions, and also let's take a moment to recognize and thank Malden Access Television for always being there for us and helping us produce tonight's show.
Okay, our first question for the panel comes from Facebook. And Amanda asks a question, which is, she's wondering if they know how many residents of Malden have actually recovered. So, we generally list current infections, but we don't list the recovered rate.
Okay. Mr. Webb?
It's 114 people.
Okay.
They've either recovered or cleared isolation and quarantine.
Now, what do you think of that number? Is it where you thought it would be? Is it less, more? Hard to say.
It concerns me so much that the other number is 427, and there's a lot of different modalities within that 427. So we're on the climb. So no, I'm not comforted by that number.
Is that something that we're going to start posting?
It's going to be a number that we'll probably do weekly because of the mining that we have to
okay.
do for that data.
Okay. All right. Is that answers it, Mr. Cochran?
That does to the question, and we got an immediate thank you from Amanda via Facebook. So that's technology at play right here. So unfortunately, we have to go to the other end of the spectrum, and we have a question that came to us via our YouTube live stream, and that is whether or not there are any reported deaths in Malden.
Mr. Webb?
No reported deaths or confirmed deaths of yet.
Okay.
But there's reason to believe there have been some, but we're trying to track that number as well. Again, the data coming in is overpowering the data we can take out.
And just so people know, the data comes from
The Department of Public Health and CDC. And another thing that's unique to Malden is we don't have a hospital. Most communities with hospitals, that health department will be issuing the burial certificates, so they'll have that. We don't have that luxury. So and the other problem is if any of our decedents are buried somewhere else, we won't have record of it. So we're trying to work with Vital Statistics and places like that to get a group of data that we can mine each week.
Got it. Okay.
Mr. Mayor, can I just add also, I know both you and I and I'm sure Chris has and other local officials are in constant communication with our local hospitals, Cambridge Health Alliance, Melrose Wakefield, and others, and want to assure folks who are, who are watching this that our hospitals are doing a great job. I mean, they have been preparing for this already for 2 months. They knew, and so they've been doing everything they can to increase the capacity they have, the number of beds, the number of ICU beds they have. They've been cross-training staff. They've been adding equipment like ventilators. There's still challenges, of course, but they really are doing a great job to be ready.
Yeah,
To make sure anyone who needs care, who has to be hospitalized, we want to make sure we can find
our
the best
Chief of Staff,
possible
Maria
care.
Luisa, and I were on a conference call recently, and we were pretty impressed with the plan that they had put together in Melrose Wakefield. And
Very
you said
impressive.
others.
Yeah, very impressive.
Okay, our next question comes from Frank on Facebook. Frank asks, will Malden be setting up a testing site? If so, will it be free? And where can we go to be tested? That seems to be a common question across all of our broadcasts thus far. I figured it bears repeating.
What's the latest on that, Mr. Webb?
It's still a little ways off. You can get tested, but the protocols are still in place where you have your primary care physician deem that you have enough of the symptoms to require testing. Keep in mind, each test has multiple devices that are used. So even the swabs are in short supply. So you don't want to go out and do a lot of testing with the supply that you have, because when you won't be able to test the people that need it. You'll be out, and you don't want to reverse the dynamic. So I think you'll see more testing when more states the curve starts to go down, and they can then extrapolate how much more equipment they need, and then they can give it to people who are what I like to call walking wounded, or seriously concerned for their own well-being or if they need clearance to go back to work. So I think you'll see that shortly.
The ones that are talking about in Malden, like Cambridge Health Alliance, that was for their patients, right?
Typically their patients,
I
yeah.
saw that permit application. What became of that? Are they up and running?
They were. They'd had a couple of days. I think they go back and forth when it comes down to staffing and equipment.
Okay.
They've got to wait for more swabs.
That's on Canal Street?
And they
they're
don't.
doing
And of course, they can only send as many tests as the lab can receive.
Yeah,
So
yeah, and that's on Canal Street, right?
it is.
Yeah, yeah.
Okay, our first caller of the night is on hold, and we'd like to bring her live. Diane, go ahead. You are on the air with the panel.
Hi, Diane.
Hi,
Diane.
Mr. Mayor. How are you?
Good. How are you, Diane?
Very good, thank you. So I have a question about the surge coming in.
Okay.
Given that we are heading into this surge and there's huge concerns about social distancing, do you feel the need to maybe impose a curfew or, some kind of restrictions on people to enforce some of this behavior? I just wonder what your thoughts were on that.
Right. We have discussed that, and we don't believe we're going to elect to do that just yet. And I think
Okay.
our feeling, Diane, has been in talking with our health director and our police chief and others, president of the city council, is that we would want, conceivably the entire state to do it. But if not that, a larger swath, because what our police chief has said that it would be difficult to enforce. If someone's passing through from Melrose, who may not have, I think they do have one, but for a city or town that doesn't have one, they come passing through, then you got to ask for, ID, where do you live? And, we don't think at this time, plus the fact that we think most people are complying. Our police chief believes over 90%, maybe 95% of what he's seeing, and he's out there quite a bit, that he feels that the community is getting it and is complying with what's going on out there. So those two factors combined, what has convinced us at this point not to enact a stay-at-home advisory. Now that could change, but that's where we are at this moment. I don't know if you want to add to that, Mr.
Oh, that's perfectly said.
Do you have feelings about it, Diane?
No. I was just wondering if there was any kind of a plan to maybe enforce something like that.
Yeah.
Given that the city of Boston has done it, but it's nice to hear that there's a high rate of people that are complying because it's so important.
Yeah, and we also think it would be very difficult to enforce, and I think our police chief and our chief of staff from the mayor's office is here. If you were going to do something like that, it would be during the day, because that's when there's the most activity. And again, we're not seeing it overnight, from 9 to 6 or something like that. So that's where we are at the moment. But this situation's so fluid, it could change. But, we spent a lot of time discussing it, and that's how we came out at the moment.
Well, thank you so much for your time.
All right,
Stay
Diane.
healthy. Take care. Bye-bye.
You too now.
It might be worth mentioning as well, we do get several questions as to whether or not we follow the orders that Boston does. It's just some folks are under that impression, since they're the largest metro near us, do we then have to fall in line? So the response that usually I'll give is no, because we are our own city, but we do take our direction on the state orders down the state, and then if an order is issued locally, we take it.
Yeah, and we do follow a lot of what Mayor Walsh and his team are doing in Boston to try to get, some ideas, which I think we have utilized over the past several weeks. But you're right. I mean, the end of the day, we have to decide what we think is best for our city, and that's why we've decided, what we have to this point.
Okay, our next question comes from Jessica. Jessica asks whether or not there'll be an extension on car inspections.
I think the state has extended inspections, right?
I believe.
Wait, do you know?
That's,
Okay. No.
I think that's right. For the most part, anything that has an expiration or a deadline during this period of a state of emergency, because the governor declared a state of emergency back on March 10th, is generally is stayed, essentially. Okay. So it would extend till after the emergency is over.
And if she wanted to contact you tomorrow,
Absolutely.
for sure, what's the...
Just best would be to send us an email at jason.lewis@masenate.gov. So that is, even though the State House right now is closed to the public, we are continuing to fully function, and my office is operating remotely, and we're continuing to serve constituents and obviously working on legislation and so on. So.
Yeah, and if the person asking the question can hang in there, I think our Chief of Staff is trying to find online for sure whether or not it was extended. But my hunch is the same as the Senators. Anything after March 10th, all bets are off. I think they've extended anything that was due after that date. But we'll see if we can circle back during the show to confirm.
I'm pretty sure that, because that would have been through the RMV,
Yeah.
right, the registry. And I know the registry took a number of actions soon after the governor's emergency order.
Yeah.
And I've also indicated to the person on Facebook what the email address, and I'll keep them on hold for that response.
Yep.
Our next question is from someone on the phone. So, Kevin, go ahead. You are on the air with the panel.
Hi, everyone. Good evening.
Good evening.
Happy you're all safe. So, I followed this panel, and I appreciate that you have it. I watch it weekly. Like I said, information is better than imagination. But today I read a very chilling article in the Post that I wanted to discuss. Maybe you know more. They were saying that there's so many cases that at this point they're treating people on a point system based on health, whether they feel they can recover or not, et cetera, et cetera, et cetera. Can y'all speak to that? Because that was a bit chilling for me.
Okay. Do you have that question?
Yes.
Can you just repeat it?
Well, I think the question was that healthcare workers right now are in a very precarious position. They have limited equipment, and people present with different levels of illness. And they have to make certain decisions about who's going to benefit most from, whether it be a ventilator, whether it be an antibiotic treatment, whether it be a blood transfusion, any of the new products that are and processes that are coming to market now are being used, but they have to be sure that the person that they're using it on is going to benefit. And if they don't believe they're going to benefit, it's chilling, but it's true. Some people will not receive advanced care because the advanced care won't save them.
Okay.
So that's the struggle that doctors and nurses are going through right now. The concern that where we're talking about today is along these lines. There's a huge, going to be a large community of people who are going to need a lot of post-care. Most of our medical workers are going to need some support when this is over. Because of these decisions that they have to make.
Okay. Does that answer the question, caller? Or?
Yeah, it answered the question. Pardon me. So just to follow up, back to the previous question that was being asked of the mayor, if we've reached this point, isn't it time we button up our city, considering the fact that the smaller town we have, our numbers are huge, right? Compared to what I see of other places, I think we're being slammed. I don't know if that's the consensus.
No.
But
I
if we're
wouldn't.
being slammed this hard, why wouldn't we just button up our city
Right.
and try to contain what's going on now?
Right.
The numbers, Chris?
Well, the numbers, you have to put things by population. Don't go by the number you hear because it's got to be relative to the population. So it's 65,000 people on a regular day, and probably a little closer to 72,000 on a business day. 457 people is not statistically significant. It's important, but it's not significant. We've done very well in this community. I'm surprised where we're at.
Compared to other cities around us.
Well,
right?
I issue orders every day, and the level of compliance sometimes isn't what you want it to be there.
Right.
And this issue was very concerning for most of us in the health department. How are we going to manage people's expectations, and how are we going to get them to buy into what we're telling them? it wasn't very hard, thankfully. Most people were doing their own research, asking good questions. We had staff out early, which I think was very important. And we had great compliance with the larger companies in the city, Stop and Shop, the Walgreens, or the likes.
Right.
So it kind of led people to an understanding, I think.
Yeah. And then again, couple that with what we said previously, that a stay-at-home advisory is just that. It's advisory. It's recommended. So to put our police chief and the men and women of the police department in that conundrum of again, if a city or town nearby doesn't do it, but they end up coming through, then you're spending time asking people where you're from, let me have your ID. I think in order for it to be effective, at least, talking amongst ourselves, you'd want a big chunk or a swath of cities and towns to, come up with a plan that would, make more sense. Or, quite frankly, if the state did it, across all 351 cities and towns, then we think it would it would be worth doing.
And Mr. Mayor, definitely I can assure you that these concerns have been brought to Governor Baker.
Right.
And to Secretary Mary Lou Sutters, who's kind of leading the state's command center. They hear loud and clear the concerns, and they are evaluating every single day, whether the measures that have been taken are adequate based on the number of cases we're seeing, based on different parts of the state, and they're tracking it very closely. So I do think if the governor decides that we do need to take even stronger measures, I think he'll act.
Yeah.
But again, I think you said, right, most people are complying and really doing the right thing. Right. The vast majority of them are. So I really
would just say one thing about one town doing a lockdown, for lack of a better term. Those people are going to still go out, and they're going to go to neighboring communities. Right. And is that fair to the neighboring community? Probably not. Yeah. Right? It's going to, there is that transition, and there is the chance for infection. Right. We have a lot of people, and I really want to make this point clear tonight, is we're finding out more and more people are walking the streets with no symptoms, nothing, but are positive. Right. So there's true carriers in the group. It could be me. I have not felt better in my life, which is odd because I'm working a lot of hours, but in comparison to other people, I'm feeling pretty darn good. I just think that people have to focus on that, right? Don't worry about what everybody else is doing. Just do what you do for yourself and your loved ones, and everything will take care of itself.
Okay. Well, thank you very much.
I just want to conclude by saying I thank every one of our city officials who gets up every day and goes out and walks out the door. I want to thank our police department, our fire, our nurses, our ambulance, even the grocers and the checkout people who are really putting it on the line for the rest of us every day. I don't think they can ever hear enough appreciation. I want to say on behalf of myself, my family, and I know my neighbors, we really do appreciate you guys.
Well, I'll tell you what, our next show, I want you to be our last caller, okay? Thank you very much.
Well said, well said.
All right, Mr. Cochran, where do you want to go next?
We do want to acknowledge Kevin. He has been an all-star caller 3 weeks in a row. He brings it. So I think you said that very same thing last week, and thank you, Kevin. A couple of quick reports. First of all, I was able to track down the information for the person asking about vehicle inspections, and in fact, yes, there's some delay in there. I pasted the article from the RMV website, so she has that information. The other question will build off of Kevin's previous question in regards to individual cities, and that's Jason, who's on Facebook, asks about Chelsea being identified as a major hotspot and whether or not there is some risk of that traveling over, since we are so physically close to Chelsea.
No, I don't think there's a huge. They do have a problem there, and it comes down to the living, the style of housing. Really, it's all it is. The housing there is generally older. A living room today is usually 20 by something. Back then, it was 9 by 10. So they're still living in 640s and 50s eras building space, even though it's been renovated, but not renovated that much because the scale of the buildings don't allow it. So people don't have the ability to distance within most of the living arrangements over there. That's a challenge. They have some over occupancy, obviously that's an issue. But as far as it bleeding over to Malden, It could only happen if those people aren't doing what they need to do and we aren't doing what we need to do. So if we're doing what we need to do, we have nothing to worry about from somebody else.
Okay. All right, great. Thank you.
Okay, we have another caller on hold, and that's Joan. Joan, go ahead. You are on the air with the panel.
Good evening, Joan.
Good evening, gentlemen. Thank you very much for being here again tonight. My concern tonight is that seniors, being one, that some of us have had to go out and do shopping and wait in the line outside the Stop and Shop and wait for our prescriptions at Walgreens. And we had one visit from Pizza Pizza for lunch. Other than that, nothing else. And I don't know if that's, because they're doing so many other buildings for seniors, or if it's just that we happen to get overlooked just having one visit from Pizza Pizza. If you could address that, I would appreciate it. Thank you very much.
Where do you live, Joan?
Live at Green Street.
Oh,
Cutica?
59 Green Street?
Yep.
Okay.
I would say that I wouldn't know why they wouldn't have more, but I would caution against having more, actually. In the buildings, especially like that, senior housing with a lot of shared common space isn't the best place to be having pizza events.
In and out, yeah.
I mean, if you can do it individually, and it would take a lot to be giving out individual slices of pieces of units. So I think that's probably why it's fallen away. It's really not a good public health practice right now.
And she should talk with the building.
Yes, I've talked to Mr.
Katie
Klain
Poon?
recently, and Katie Poon,
Yeah. Have you spoken with the people downstairs?
The office has been closed. There's
Oh,
been
okay.
nobody there.
But I know there's contact info.
They're working remotely, yeah. Phil Klain is on email and telephone, so the office rings to his
Do you
home.
have their info? Not on you, right?
Not off the top of my head,
Can
no.
you give them your number?
it's-
Joan,
Yeah.
tomorrow, if you want, call Mr. Webb's department, and we'll try and get a contact for you, okay?
Okay,
He's
great.
gonna
Thank you very much.
he's gonna give you the number right now, Joan.
The number's,
Okay.
the number's 781-397-7049.
All right, call tomorrow. We'll see if we can connect you.
The last four numbers again?
7049.
6049?
7049.
Okay, thank you.
All right,
Thank
Joan,
you.
hang
Very
in.
much.
All right,
okay,
hang in there.
you too. Thanks. Bye-bye.
Okay, our next question comes to us via Facebook, and the question is, are there any changes to property taxes due date?
Yes. We just signed an executive order yesterday extending the due date to June 1st. And we're going to continue to work with the legislature to see if there's other things that we can
And
do.
Mr. Mayor,
Yeah,
I
please.
assume you waived interest and
Yes.
penalties as well,
Yes.
right?
Yes.
So that's a real help to
Yeah, and
residents.
if we want to just let them know, the reason we were able to do that was because of the hard work of Senator Lewis and Representatives Altrino, Donato, and Lipper-Garabedian, who have been working with the governor's office to allow us to be able to have those tools, such as what was just mentioned. And so we want to publicly say thanks for doing that.
I'm glad you've already been able to use that to help out the residents.
And do you
of the
see
city.
more of that coming depending on the length of the crisis?
Yes, in fact, we are looking at another piece of legislation is moving today, and in fact, I think it's on the governor's desk now. That is some additional tools for cities and towns, and it includes waiving the MCAS testing requirement. I know that's been a concern for a lot of our students and teachers, right? You know, the last thing they want to focus on is taking standardized tests.
Right.
We just have waived that, and we expect the governor to sign that tonight or tomorrow.
So the House did the same?
They've
Yeah.
agreed, yes,
They
the
agreed
House
to
and
it.
Senate have
Okay.
both agreed.
Okay.
We've been working on this to get to agreement for a few weeks, and the legislation was passed today.
Yeah, so now that we issued the executive order, our Controller Chuck Ranigan and our Treasurer Dan Grover are working hand in hand to be in touch with everyone on the next steps. But it has been extended to June 1st.
Okay. Our next question comes to us via Facebook, and again, these are questions that are commonly asked, so a lot of times we will summarize these and not necessarily say who specifically it came from, because it came from so many folks. Question is in regards to, has Malden received money from the Federal CARES Act? And if an explanation could be given about how the CARES Act benefits individuals in Malden.
We have. We were notified, thanks to the work of our Congresswoman Catherine Clark and our United States Senators Ed Markey and Elizabeth Warren, that Malden is going to receive $821,000 as a result of the CARES Act. So as soon as we received word, we got to work with the City Council on coming up with a plan with the Malden Redevelopment Authority that is going to be twofold. It's going to address the impact that this crisis has had on small businesses, as well as people who are having housing insecurity issues. So we plan to file that with the City Council Tuesday night, April 14th, so next Tuesday. And we'll probably release some of the particulars about it once we firm them up, but that is our intent come this Tuesday.
Okay, our next question, actually, before we get to our next question, we have a few folks asking us about number of cases. They just came in a bit late to the broadcast, so maybe we want to reiterate that. But we also want to remind folks that as of tomorrow on the city's website, we're going to be revamping our COVID-19, our coronavirus information into one easy to use and find page. And on that page will be the daily number of cases. So we'll make that a lot easier for folks to find. Again, look forward to that tomorrow sometime early afternoon. The next question is, can a person apply for unemployment if they are self-employed?
All right, let's go to our Senator.
Okay, that's a great question. So ordinarily, you can't apply for unemployment benefits if you're self-employed or if you're an independent contractor, you work in the gig economy, because you're not a W-2 worker and your company hasn't been paying into the state's unemployment insurance trust fund. But thanks to the Federal CARES Act, the same legislation that is helping out the city, like the mayor just discussed, and our congressional delegation, great work that they did, there is funding included in the CARES Act to expand unemployment benefits eligibility to folks who are self-employed or who are independent contractors, basically 1099 workers. So that's really, really great news. And you will be able to be eligible for whatever the benefit amount that there'll be a calculation based on your past earnings. And then in addition to that, you will also be eligible for the additional $600 a week that everybody is eligible for, again, as a result of the CARES Act. It's an additional $600 on top of your regular weekly benefit. So the only last thing I would say is, unfortunately, because this is a brand new process, the state actually has to stand up a new online system to process the applications, and they are doing that right now, and they expect it'll be ready to process applications April 30th. So just a couple more weeks, hang tight. Don't worry, once your application is processed and you are approved for receiving unemployment, it'll be backdated to when you lost your income or you lost your job. So you will get that, but you unfortunately have to wait a little bit longer if you're self-employed or an independent contractor. If you're a W-2 worker, work for a company and you've been laid off or furloughed or lost or hours reduced, you can go online on the Department of Unemployment Assistance website, right now, do it immediately and apply for benefits. And if you have any difficulty with the system, reach out to my office or one of our state representatives and we can help with that.
Okay, great, thank you.
Okay, our next question is, have our hospitals run out of beds and equipment similar to what's going on in New York? And if not, are there plans in place to address that if and when it does happen?
Okay, you could probably both speak to this. So, Mr. Webb, what's the capacity like at our
The capacity right now is we're not at divert at any of the hospitals, so that's a good thing. But I do know that Melrose, Wakefield, Whidden, and the city of Medford are looking at programs to expand those beds.
Okay.
And you know, some of them will look a little different from one another. Some will be people who are ready to transition out of the hospital, or some who have not transitioned up the chain of symptoms. So they'll be a little different depending on whether they have oxygen or how much power they can provide with, you know, could they have ventilators there? Each site might be a little different as you look around the state. So don't look for a cookie cutter solution to it. It's going to be a little different wherever you go. But there are at least those 3 options out there, and they were part of the planning. And I want people to understand there's emergency planning going on every day. Senator Lewis will attest to it. He's been a great supporter of public health planning for years now, and I want to thank you for that. He's incredible amount of support. We wouldn't be where we are, really, in this state without his support.
So you want to add to that? Like he said, you're very much involved with this.
I just want to assure people, I know everyone is very worried about this, and should you know, you or a loved one, you know, have to be hospitalized for any reason, even if it's not COVID-19, could it be a heart attack or a stroke? Our local hospitals are really, I think, I'm very impressed with what they're doing. I mean, as you said, Mr. Mayor, we were on a call with the senior staff of Melrose Wakefield just a couple days ago, and they were taking us through their whole emergency plan, and they have been planning for many weeks now to expand the number of beds, and they've converted, you know, whole areas in the hospital for COVID patients, and they've increased significantly the number of ICU beds. So they've been cross-training staff as well, and so, you know, and this is all in anticipation of, you know, an increased number of patients. So they're preparing for it.
Okay.
And I'm proud to say, again, with your help, we were able to send cots, bed equipment. We could basically send 50 beds over to Melrose. So they're you know, we were happy to be able to help.
Okay.
And the state government also is under Secretary Sutter's leadership. She's the State Secretary of Health and Human Services, is looking at the capacity we have in each of our hospitals and health centers across the state. And then we've got projections for how many you know, people we expect will become infected with the virus and need to be hospitalized, because we've been working with epidemiologists. So they also are planning out, you know, where do we need, you know, more capacity. And people have probably read about standing up at the convention center and various other places to make sure we have extra, you know, beds available should we need them. We hope we don't. We hope we don't. But if we do need them,
It's
we
good
want
practice,
to be ready, right?
Yeah.
Be, you know, prepare for the worst, hope for the best.
Yep. Thank you.
Okay, our next question is in regards to rent. If someone is unable to pay their rent, what are the options at the local or state level? And if they were sort of up against it and they really had no choice, would there be a threat of eviction at this point?
So, Mr. Mayor, I've got some great news for our caller. Just today, actually, the State Senate passed really strong legislation to put a moratorium on any evictions or foreclosures in Massachusetts for the entire length of this emergency, and then I believe for 60 days after it ends. So if somebody is not able to pay their rent, you know, as a result of this crisis, and you've lost your income, you would not be at risk of losing your apartment or your home. You would be protected.
That's a Senate bill, is it?
The Senate has passed it. The House also has done great work. They've passed a very similar bill. So we're in the final stage of the legislative process now, where we just have to, there's a few differences between the two, and we are going to work those out. I'm hopeful we will do it within days. So
that'll be on the governor's desk.
And it'll be on the governor's desk.
Now,
so
Senator,
that is a high priority.
If it was to pass, so does it go back to March 10th when the thing started? How does it work?
It would be effective as of when the bill is signed into law.
Okay, and then
so
how do
would
you
basically prevent anything going forward?
Okay.
So
And then how would you determine? Is there like some kind of testing or
in terms of to prevent
who's eligible? Yeah,
anyone.
Okay.
So any residential eviction, and then the legislation would prevent, you know, any notices to quit being sent, or, you know, I'm not an expert on housing law, but there's a whole series of processes that, you know, that a landlord would go through. it basically puts a halt to any of that.
Okay.
So there would be no actions taken, no notice to quit, no court proceedings, if somebody is not able to pay. Now look, we hope that people who can still afford to pay their rent, please continue to pay your rent and your mortgage, because, we need landlords to be able to pay their bills, and we don't want our banks to fail. So we really want people who can afford to continue to pay their bills to do so. But if somebody really is facing hardship and is having trouble paying their rent or their mortgage, then this would make sure they're protected all throughout this.
So one more time,
this crisis.
No foreclosures, no evictions.
Correct.
But does it allow not to pay?
Technically, it doesn't say you can't pay your rent. The rent's not being excused or forgiven.
Right.
But you would not be able to be evicted as a result of this.
Okay.
Right. That's right. And with mortgages, there is actually in the legislation forbearance, which means that the bank would allow you to make it up. They'd add it onto the loan, so you would not you'd make those payments up later. But you can't really do that with rent.
Yeah. Right.
Right. So hopefully that'll be the law in Massachusetts very, very soon to protect people.
Okay.
Okay, we don't have any callers at this moment. We are coming up to the scheduled end of the show anyway. But again, as we've always said, we will go longer if need be. But we do want to ask one question that comes in frequently, and that is, what are the restrictions? There were some different restrictions for grocery stores, and have those changed recently?
Okay, Mr. Webb?
Yes, they have changed, and I really wish the governor had called me, but
I'll let him know that.
He's a little busy. He's a little busy. What we did last weekend was we reduced the amount of people in grocery stores. So in Malden, we have a Super Stop and Shop and 2 Asian markets. Mm-hmm. They're all various sizes, but what we found was we went to Stop and Shop and we saw other cities with similar size shops. Plus, we saw the capacity that they currently had and figured that 150 was a good number of people per employee kind of setup. We were really getting concerned for the safety of the employees. So we went to the Asian markets, and they had already taken it into their own hands and were satisfied with 100. So we were left at 100. Once we did the supermarkets, of course, the pharmacies got overrun because there were lines at the supermarket. So we had to step in, and luckily our friends at Walgreens called us and told us we're having a problem, what can we do? We made a recommendation of going down to 25 people inside and 25 people in line. And that seems to be working out very well. We made notice to CVS this morning. We thought they would have come online without prompting, but they needed a written invitation.
Okay.
So we gave them one. And they're all working out fine. Everybody's doing it correctly. There have been no issues. We send inspectors a couple times a day, always at different times, for counts. And so far, so good.
Okay, so Super Stop and Shop one more time. 150 customers inside at any time.
At any time.
And then outside, 50.
50.
And they're spaced?
That would be 6 feet. It's 300 feet. That's a long line.
Got it. Okay.
Okay, the next question is from Sabrina, and Sabrina asks on YouTube, she's concerned about potential hate crimes against folks specifically she's asking about our Asian population and whether or not there's been a report of any of that, and then I'm presuming here what is being done or what can be done if that is the case.
Yeah, we are as well, and our stance hasn't changed, which is we are not going to tolerate any of that. And we have been in close contact with the different organizations that we've been working with since we came into office, such as the Chinese Culture Connection, the Wallam Kung Fu and Tai Chi Academy, ACDC, and others, to keep an eye out to see if there's anything that they're hearing that we can act upon, because again, that is not something we are going to tolerate here in Malden. Also, our police chief, who we continue to meet with weekly, has been keeping an eye out as well.
Can I say one thing to
please.
that? It's not any nationality. Mm-hmm. It's 98.6.
Right.
That's it. Any human with 98.6 is susceptible to this virus. So if you're not at 98.6 and you're above, no one's going to care what your nationality is. Right. So focus less on that and focus more on how you protect yourself and your loved ones.
Yeah, and I'm pleased to say at this point we have not had that.
No.
Knock on wood.
Right.
Not that I'm aware of.
Right.
Okay, there is a question for Mr. Webb, and that's in regards to monitoring. If you could please elaborate what that means when cases are being monitored.
That means that the nurses are calling these people every other day at least, and they're having conversations with them about their current health status, who's in the home, has anybody left the home, has anybody been hospitalized, if so, where. So it's always, depending on how far into the process you are, the questions change, but they're getting phone calls just about every other day. And if anybody's listening and you're not getting calls, let me know. We'll follow up with your case. Sometimes it comes down to you weren't home, your answering machine didn't pick up, little things like that. The nurses get frustrated by
Now,
those things.
let's say someone is being monitored, and then they decide halfway through that they do not want to be monitored any further. Do you have any?
We do have the authority to put people into mandatory quarantine if we have to.
Okay, you haven't had to do that.
No, we have not. Everybody we've dealt with has been appreciative, wanting more information, and saying they would have done it anyway.
Right.
The word is out. I think most people, a lot of people give us advice about how they're curing themselves. I won't share that because some of them I wouldn't recommend, but
Right.
they're working for them, and that's fine. But the creativity level is up there. That's on that kind of
Right,
stuff. But
right.
yeah,
Okay.
stay focused on yourself.
I think we have a caller.
Yes, we do actually, and we do have Kevin. Hold on, I don't know if it's the same Kevin, but go ahead, Kevin. You are on the air with the panel.
Hi, Kevin.
Hi, it is the same, Kevin. Y'all brought this up, and I just wanted to speak to the great city that I live in. I witnessed some harassing speech towards one of our Asian neighbors. And before I could even open my mouth, the entire community turned around and spoke to it. So I just wanted to say, this is the town I live in. We are very tolerant of each other. We love each other. And for anybody to believe, like that gentleman said, COVID-19 discriminates, that is totally, totally out of space.
Right.
It doesn't care if you're rich, poor, young, beautiful, ugly. It cares, like you said, a beating heart and the right temperature, and that's all it's looking for. So I just wanted to speak to Malden. I just witnessed that myself.
We're happy
And
to
I'm
hear
very
that.
proud to be from Malden.
We're happy to hear that, Kevin, but we're not surprised.
Yeah, I'm not.
Okay, thank you, Kevin. Thanks for that follow-up. At this moment, we've actually concluded. I think we've got all of our questions. If anything else comes in after this, we'll certainly make an effort to get back to all those who ask after facts. So we'd like to leave some time for the panel to closing remarks.
Okay. Do you want to close out with anything?
Just again, I can't say it enough, so I will say it. Focus on yourself. Take good care of yourself. Take good care of your loved ones. If you can, help out a neighbor. Keep your distance. It's not prohibited, but when you can, help out. I had help today getting toilet paper. I'm not ashamed to mention it. So that's important, but don't underestimate the times we're in. Everybody thinks we're leading up to this moment. No, this is not the moment we want to be in. We want to be 3 or 4 weeks from now. Then we can start talking about normalcy and what does it look like. So focus, stay committed to what you're doing. Just stay focused, stay home, and stay healthy.
Okay. Senator?
Again, thank you, Mr. Mayor, for everything you're doing, and Mr. Webb and all your teams are doing a great job. And I know we're in very scary times right now. It's very uncertain. We obviously none of us have lived through this before, but we're tough. We're resilient. We're going to get through this together by supporting each other. That's so great that we ended on that point. We're not turning on anyone. We're supporting each other, and I will continue to do everything that we can. In our government. I know we're doing it in the municipal government, the state government. Who would have thought we could get our Congress to actually, finally work together and pass important legislation? That this pandemic has spurred that. So we're going to keep working together make sure, first and foremost, we deal with the public health emergency that's in front of us and try to minimize the number of people who become ill and have to be hospitalized. And at the same time, we're going to do everything we can to help people who are being hurt by this and our small businesses that are being hurt by this, and we'll get through it together.
Great. Well, thank you. And again, I just want to end by thanking Malden Access Television for continuing to partner with us to update you on this healthcare crisis. And I want to thank Maria Luisa, our Chief of Staff, as well as Ron Cochran, our Communications Director, who I know, if not for this, you would be observing Holy Thursday. You'd be at Mass right now. Do I have that right, Mr. Cochran?
That is correct.
Yeah, so I want to thank you. And then, you know, as the Senator said, the, you know, this is real. The fear is real, but what is also real is the community spirit. Maria Luisa and I are just so impressed with the stories we're hearing on a daily basis of residents and businesses coming together to help us get through this crisis. And, you know, we just wanted to say thank you for all that you're doing, and please continue to be safe. Thank you.